My name's Sharon Wan, and I'm one of the MSW students here at the clinic. How would you like me to address you?
Bruce.
Bruce? Okay, Bruce, it's nice to meet you. I understand that you came here and were referred here by your doctor. Can you tell me why you're coming?
I have been. I can't think of the word.
You've been...
I've been required
Okay, required by...
from my employer.
Okay, so your employer said you have to come. Can you tell me a little more about that?
They have been, HR has been receiving complaints about how I treat people.
Okay, so, and what do these complaints revolve around?
Well, they say that I'm abusive and not fair, and I scream and yell at people.
And what's your take on this?
I think they need to suck it up.
Mm-hmm. So, when they say, can you give me some examples of sort of what the situations are?
I'm not really sure.
They've not talked to you about specific things?
Not really.
Okay. So, and you feel like that people just aren't doing what they need to do, or they're not, that you're...
They need motivation.
Mm-hmm. Mm-hmm. And this is your way of motivating? Mm-hmm. Okay. Are you in a supervisory position?
I am.
Okay, tell me a little bit about your work.
I manage the facilities crew and security at Thoroughbred Horse Farm.
Mm-hmm.
And we have 5 total and 3 in this vicinity.
Okay, so 3 farms in this area.
Correct.
Okay, and so you manage all the facilities, all the grounds and buildings and security for all 5, or these 3 here?
These 3 here mainly.
Okay.
I am in another position where I go to the one in New York and supervise work performed up there.
Mm-hmm. Okay. And so are these circumstances, when you're motivating people, tell me a little bit more about what's going on during those situations.
I send emails every morning, and a lot of people, I don't know that they don't read them, they don't understand them, that they don't do what they're being asked to do.
And so you respond how?
I'm sorry?
And so your response is what? If we were there, what would be like, and I was somebody who didn't do something you had asked me to do, what would your response?
Why aren't you reading your email?
Okay.
And if you don't get it and you have questions, why aren't you contacting me?
Okay. And their response would be? so then how do you react to that?
Not well. It's extremely aggravating, and I get in their ass.
Okay. And so, is that effective?
Yes.
Okay. Okay. So it serves a purpose.
Yes.
But it's causing you problems at work.
Yes.
Okay. So, how long have you been in a supervisory position?
For my current employer, about 5 years.
Okay.
For my employer previous to that, about 20.
Okay. So this is, your career has basically been supervisory work.
Yes.
Okay. And would you say your style has been the same throughout, has changed over time?
Mostly the same. I think it's changed a little bit since I came here to this region. I think the people here lack motivation.
Okay. Okay. And so it's changed since you came here, and you said the people here lack motivation. So am I correct in getting the idea that maybe you do more of that kind of motivation?
Yes.
Okay. And so, and your employer has required you to come. So there have been complaints, and so what else have they said about that? Have they, is that an ultimatum? Was it a suggestion? Was it?
No, it was a suggestion.
Okay. Okay. And so you came here by choice of sorts.
Correct.
Okay. Okay. But at this point, your job's not on the line with this. It was a suggestion.
Correct.
Okay. Okay. Tell me in general what about, let's see, your life in general. Have you ever gone for psychotherapy before? Have you ever in your life had any psychotherapy treatment?
When I was a teenager, I had an abusive mom.
Okay. All right. And so you, tell me more about that. Did you, what kind of, you had an abusive mom. Did anyone know about that?
I believe so.
Okay. Was there anything done about that?
No.
No. Okay. So, what precipitated or started you going to therapy back then?
My father recommended that.
Okay. Tell me about your folks, your family. Were they, did your parents remain married? Were they?
Yes, I did.
Okay. Tell me about who all lived in the household.
Just my parents and myself.
Okay. And so did your dad know your mom was abusive, or did he just recommend you go because of things that were going on with you, or what?
I think maybe a little of both.
And what was going on with you? what kinds of things did your parents see or your dad see that kind of initiated his suggesting this?
I was withdrawn and kept to myself. Kept a distance from other people. Stayed in my room.
Okay. So you would describe your relationship with your parents how?
With my father, very good. With my mother, okay. We just weren't close.
Okay. And the therapy you had then, was it helpful?
Maybe. Didn't say.
Okay. How long did you do therapy for back then?
Maybe 6 months.
Okay. All right. And now how would you describe your relationship with your folks? Are they still around?
No, they passed away.
Okay. While they were still living, later on in life as an adult, how would you describe your relationship with them?
I was cordial with my mother. And my father and I got along very well.
Okay.
We lived right down the road from each other.
Okay. So, talking about your folks, what kind of parenting style did they have?
My father owned his own business, so he was gone a lot. My mother was very abusive. Excuse me, was very strict, demanding.
Okay. And in terms of discipline, how did each of them discipline you?
I'm sorry.
How did each of them discipline you?
My father was more of a laid back. I think that he relied on my mother for the discipline part of it.
Okay. And your mom's discipline?
I'm sorry?
And your mom's discipline? How did she discipline you?
Screaming, yelling, hitting.
Okay. Not what every kid wants in discipline. And so, moving away from that a lot of, I'm going to ask you a couple of personal questions right now, and if you're uncomfortable with them, let me know, okay? But I find it really important to ask these questions. In your lifetime, have you ever thought a lot about doing harm to yourself, hurting yourself?
No.
Okay. Have you ever thought about killing yourself?
No.
Okay. Have you ever had urges or impulses or desires to hurt other people?
No.
Okay. What about destructing property or getting in fights or harming animals?
malicious fights with other people, other guys. Sure. None of what she said about the others.
Okay. So sometimes fights with other guys. And when would those occur? When have those occurred?
Well, teenage years, I mean.
Okay. And not since you were a teenager?
No.
Okay. Deceiving people?
I'm sorry.
Deceiving people?
Deceiving people.
Lying to people?
No.
Okay. All right. I'm going to ask you about, the next thing I'm going to talk about are different sort of emotional systems that everybody has. And the first thing I want to ask you about is your mood over the past couple of months. Kind of normal or lower than normal, higher than normal. How would you say, describe your mood over the last couple of months?
Well, what do you mean by low and high?
Well, if you take how you normally feel, and low meaning maybe sad or depressed or blue, irritable, kind of without interest or energy. High would be super cheerful or super motivated and high energy. And
the last few months, probably, I would say higher.
okay, all right. And is that more a cheerful kind of high? Is that an irritable, can't sit still, can't stop moving kind of high?
Not cheerful.
Okay. And what about sleep? How are you sleeping these past couple of months?
Fairly well, for the most part.
For the most part, how many hours of sleep would you say you get per night?
Seven.
Okay. Uninterrupted?
Except for the dog.
Okay. And do you feel rested when you wake up in the morning?
Yeah.
Okay, great. Another thing I want to ask you about is if you ever have visions or hear voices. Is that something you've ever experienced? Okay. Have you ever had the feeling that people are following you or trying to hurt you?
Following, maybe.
So give me like maybe an example of when you felt like that.
When people that I have fired in the past, I have thought that they have been following me.
And what made you think this?
Seeing their vehicles.
Okay.
I might add that I used to be a police officer,
Okay.
so it's kind of a natural instinct.
Okay. So you kind of are just naturally watchful.
Yes.
Okay. And have you ever felt like you've had special powers? You could read people's mind, know what they're thinking.
No.
Okay. Did you ever feel like when you heard things on the TV or the radio that they were directed at you?
No.
Okay. What about anxiety? Do you ever, over the past couple of weeks, have you experienced a lot of worry? Do you ever get any unwanted thoughts or images in your mind that you really can't get rid of, and then feel like you've got to do certain things to get rid of those urges? Or okay. So, what is the worst thing that has ever happened to you in your life?
Probably when my father passed away.
When your father passed away, okay. So you've talked some about your mom's abusiveness. What was the worst thing with her that she ever did?
Stabbed me with a steak knife.
Okay. And was that, how old were you when that happened?
9 years old.
Okay. Was that something that was that kind of event? Was that common? Was that an extreme event for her?
No,
For
it
the
was an
abuse?
extreme.
Okay. And so her normal abusive behavior was less extreme than that. But would you say she was abusive your whole life? Was there a point when you remember she wasn't abusive and became abusive?
No, once I was a young adult, it ceased.
Okay. Did you ever tell anybody about what happened with the knife?
No.
Okay. Did she take you for medical care? How did?
No.
Okay. All right. And how has that affected you at all, other than your relationship with her? Has that affected you at all, the way she treated you?
I don't believe so.
Okay. Do you ever, like everybody has times when they just sort of lose a moment or two and kind of lose time. Do you find that you frequently lose time, like you don't know how you got someplace, or sort of have evidence that you've done something, but don't recall doing it?
I don't believe so.
Okay. Had people who were familiar, people and places that are familiar to you that just feel not real?
I don't believe so.
No, okay. Or, felt so detached from yourself even that you kind of feel like you're outside of yourself watching a situation?
Maybe.
Maybe? When might you feel that way?
I'm sorry.
When might you feel that way? What might the situation be?
Well, just things of the past. More so when I was a police officer.
Okay. When you were a police officer, that sometimes can be, police officers can sometimes experience and see some pretty difficult things. What was like the worst thing that you experienced as a police officer?
Probably a kidnapping.
a part of the investigation or a part of the?
It was a part of the investigation.
Um, has that affected you since then, you think?
I don't believe so.
Okay. So now I'm going to ask some questions about alcohol use. How often do you drink alcohol?
Every other day.
Okay. And on an average day when you're drinking, how much do you usually drink?
3 or 4 bitters.
Okay. And do you ever binge drink?
I have occasionally on vacations.
Okay. Do you ever have any problems from drinking?
Such as?
Let's see. Getting in an accident, an automobile accident, DUI, blacking out, having maybe losing inhibitions and doing something that you wouldn't normally do.
No.
Okay.
To none of the above.
Okay. Have you ever experimented with drugs?
I'm sorry?
Have you ever experimented with drugs?
No.
Okay. What about prescription meds?
I currently take an antidepressant.
Okay. And that was prescribed by?
Physician.
Okay. And you take that as prescribed?
Yes.
Okay. So you've never experimented with painkillers?
No.
Okay. Okay. Do you ever bet or gamble in a way that interferes with your ability to do what you need to do?
No.
Okay. So the next thing I'm going to ask you about are people's personalities, are your personality. And so people, when they think about themselves over time, they can kind of see patterns of thoughts and actions and moods. And so think about back from the time you were young. Can you see sort of any patterns of mood or thoughts or actions that seem to like make up who you are? Ones in particular that have caused you problems?
I'm not sure I understand the question.
So, let's see. Sometimes people have moods that cause them problems, and it's not just a 1 or 2 time thing. It might be throughout their life. They have these moods that cause them problems. Sometimes people's actions over time, somebody might do something one time that causes them a problem, might yell at somebody or get in a fight. Like you said, when you were a teenager, you were sometimes in fights as a teenager, but that didn't continue throughout your life. So for someone who that did continue throughout their life, that might be a pattern that was problematic for them. Have you had any patterns in your life that cause you problems?
No.
Okay. And any chronic medical problems or past medical history?
No.
Okay. Have you ever hit your head or lost consciousness?
Yes.
Okay. When did that happen? Excuse me.
When I was in grade school, ice skating, and fell.
Okay. Did you have to go to the doctor or anything?
Yes.
Okay.
Had a concussion. It was not cool.
Okay. Since then, do you have any issues with memory or?
I mean, I have issues with memory, but you know, I just believe that's part of age. I don't think
So it didn't happen back then?
after that.
Okay. Did your family have any psychiatric history? Any issues?
None that I'm aware of.
Okay. So growing up developmentally, did your mom have any problems with your pregnancy?
I don't believe so.
Okay. You know, you said your mom was abusive growing up, that you got in a few fights. When did you reach puberty? Or begin puberty? Do you know how old you were?
15.
Okay. How did you feel about that?
I didn't.
Okay. Didn't think much about it?
Mm.
Okay. Any behavioral or learning problems while you were in school?
No.
Okay. Any trouble socially or academically?
No.
All right. Did you have friends while you were in school? Were you alone, or how would you describe yourself?
Oh, I had lots of friends.
Okay. Growing.
High school, later years.
Okay. During your growing up time, did you have a religious faith your family practiced?
No.
Okay. What about now?
No.
Okay. And have you ever been in the military?
No.
Okay. Have you ever been arrested?
No.
All right. Now, back to the issue that brought you in. Now, you said your boss, your employer, has recommended that you come in for some therapy, and you said because they have gotten some complaints of people saying you've been bullying them. Do you find in other parts of your life that there have ever been these kinds of situations?
I don't believe so.
Okay. So nobody's ever said to you anything ever about how you treat them?
No.
Okay. And so what is your employer wanting for you from this?
I think they just want to be able to put in their books that I did it.
Gotcha. Okay. And so what are you wanting from this?
The piece of paper that says that I did it, that I was here.
Okay. Do you think that you said in the past you didn't, that you're currently using these kinds of management strategies more